I'm Kristen Lilly. I'm the executive director at Medicines for Humanity. And I'm going to give you a little bit of background about who we are as an organization. Several of our colleagues have joined these calls a couple different times and have really benefited from this one and the Creole networking meeting. So we're excited to share a little bit more about the program. And then Esther is going to tell you more about Learning for Humanity specifically and some of the things Barbara mentioned and different courses we have available. So, Medicines for Humanity, we're a nonprofit organization that is based in the US, but we work in developing countries. Our mission is to save the lives of vulnerable children and their mothers. So, all of our work is focused around ending preventable diseases, working in communities that struggle to provide those services that can easily help children survive. So we are working in 7 countries right now. Esther, if you want to go to the next one, we work in 7 countries. Our focus is on communities that have high rates of child mortality and maternal mortality. So the topic next month for maternal and child health is right up our alley. That's our whole focus. But instead of just sending people to set up an office in another country, our goal is really to support in-country providers that are already there. There are a lot of people, even like we just heard about people going back, there are a lot of providers in countries that have the skills and the knowledge and want to be able to develop more, that we don't have a need to send people of our own to run these programs. So Medicines for Humanity as an organization partners with those in-country providers. A lot of our partners are faith-based institutions, and many of those are Catholic sisters who are in some of the hardest to reach locations. So we focus on a lot of rural communities or communities that are in urban slums that are hard hit by different types of illnesses and things that are happening within those communities. And we partner with them to be able to improve their clinical services, start or enhance community health worker programs that can reach out in the community and provide that community health education. We focus a lot on nutrition, water and sanitation, and capacity building. So I mentioned we're in 7 countries right now. That's 2 in the Caribbean, Haiti, and the Dominican Republic. We also work in 5 sub-Saharan African countries. Next, Esther, next one. One of our main focuses is capacity building. And before the pandemic, we did a lot of in-country trainings, which are wonderful, and there's no replacement for in-person training. But we heard a lot of feedback from partners that we work with that it was difficult to either leave their clinics to get to an in-person training for a week or even a couple days. A lot of our partners, especially in Haiti and places like the DRC or Sudan, they were having trouble traveling to get outside of their community. So, for example, in Haiti, we would do some trainings in Port-au-Prince, but sisters from the north, when things were getting bad back in 2018, had a lot of trouble coming down from the north to Port-au-Prince. So across the board, a lot of our partners were saying we can't do in-person training. We were already thinking about the idea of how can we make that more accessible to them. And so that's where Learning for Humanity started as a program. And that was developed to be able to provide more training that didn't replace, but kind of enhances that in-person training virtually and allows that connection between people in country and people across the world to develop their skills, but also network with other providers and learn from one another. So that's how we developed Learning for Humanity. And Esther is our program coordinator, and she's going to share a little bit more about how it works and how you can get involved and what types of courses we have. So over to you, Esther.
Thank you. Thank you, Kristen. And thank you, Rachel and Barbara, for inviting us to present today. And I just want to say that we will have this same presentation in Creole tomorrow. And that's also exciting in order to reach as many people and as possible. So who is really Learning for Humanity for? Well, it's for, I would say, anyone who is working with maternal child health first, because that's part of our mission. It was designed originally for Catholic sisters, frontline health workers, and community-based health leaders who were serving vulnerable communities, as just Kristen said, and very hard to reach communities. It's also for professionals who are involved in health services delivery and management. And this is not only including clinical care, pharmacy, but also anyone who's working in community health, in leadership positions, administration, project management, and related roles. Many times, sisters and participants will come in and apply and then say, well, I don't know if this is for me because I don't work directly, in the clinic part of the place that I work at. And we always have to say that there's a lot of other skills that people must learn in order to successfully drive a health facility. Um, what is important is that learners who come to us have basic digital literacy. That they know how to access a phone and manage how to have internet access, right? And that they are able and willing to learn to participate in an online learning environment. We're looking always for participants who are committed to completing the program and applying their learning. And by applying their learning, I mean including developing practical plans or projects that respond to their locally identified needs in their organizations or communities. At the end of each program, we ask them to develop a project plan on an identified necessity that they have in their local context. And we always emphasize that it's about planning for that project, not necessarily implementing it, because we know that in different contexts, there's not enough room for implementation because of different social insecurities. But we emphasize that even planning is a capacity building opportunity. The program has intentionally included people in management, financial and administrative positions, leadership, and just not just clinicians. Participants need the thing is that participants do need enough connection to community work to use what they learn in practice. Learning for Humanity, therefore, is designed for people who want to do something with their learning. And that's why we always ask for that developing of the final project plan in order to assess and to learn and to mentor the participants into applying the tools to a real challenge in their community. That's our website, or that's part of our where you can reach information about us. We offer currently 16 specialized learning paths designed around the practical needs of frontline health workers. Topics range from healthcare management, leadership, pharmacy, nutrition, WASH, project management, M&E. And then there's what I like to call the soft skills, but not necessarily soft skills path, which is advocacy, communication, leadership, uh, mentoring, that are also very much needed in positions because we want to carry forward what we're doing in the projects, right? We don't want all that knowledge to stay with us. So by mentoring, by being good leaders, we're also teaching forward. And we always want to teach forward. All learning paths are intentionally practical and progressive. Some provide foundational skills, while others build on previous learnings and require prerequisites. So, for example, a monitoring and evaluation learning path, you can't do it just at the beginning. You have to go through project management first so that you understand why that monitoring and evaluation is important while you're developing the project yourself as a project manager. Um, Depending on the topic, learning paths may range from 5 weeks to 9 weeks, depending on how much depth each topic requires. All learning paths are available in English. 15 of them are available in French, and by next year, all 16 will be also available in French. And we also have some offerings in Spanish. What is especially important for us is that these are not simply courses where participants just receive information and read and do a very passive learning. Instead, we're expecting students to connect their learnings to the realities they face, to the communities they serve, and to translate those learnings into stronger services for their communities. Um, Next one. Yeah. So what does participating look like, right? Right there, you see the path with the different courses, and you're also seeing a screenshot of a forum discussion. So Learning for Humanity is a fully online program. It allows participants to learn from wherever they are. Once enrolled, participants enter a learning path made up of several courses. Depending on the topic, they may encounter short readings, videos, practical activities, reflection exercises, and opportunities to interact with the facilitators and other learners. Um, But as I've said before, we're always working on participants developing toolkits and reflections and checklists and many tools that they can then carry into the real work and apply there. For example, the pharmacy learning path has a lot of different checklists that are intended for participants to better manage their pharmacies, learn how to avoid stockouts, for example. And what I think makes the difference in our online learning is that even though the courses are asynchronous and anyone can join in whenever they want at the time of the day that they have time to do so, there's a strong facilitation support. That means we have 4 dedicated staff, including myself, to following up with students, answering questions through email, through WhatsApp, through Zoom, if there's a necessity to meet on a Teams call or a Zoom call. So learners don't feel that they're alone. There's always someone who is monitoring their progress, reaching out if we see they're falling behind, helping them navigate the platform if they encounter any troubles. And so basically, when we say online learning, we are talking about a supported learning experience where students do come in and do the courses on their own, but they know they have a community that they can reach out to. And I especially like that in the WhatsApp groups because we have groups of students there. And sometimes because of time difference, for example, I'm taking care of, um, for example, people in Malawi, and I myself, I'm in Puerto Rico, so time difference won't work. And I wake up and I see the messages, and oh, another student already answered a question that a student had. So there's also that communal sense of helping each other out. Um, and this graphic I love. I was able to do it this week, so I absolutely love this graphic because it shows you the students from around the world, people from around the world that have enrolled in our program, more than 50 countries, with a very strong presence in Haiti. And that has to do in part to the Dalton Foundation and all the promo they have done for us in the past. So people in all of these countries around the world have developed projects, and a lot of them have implemented those projects, and that is also exciting. Those projects goes from improving how a health facility manages supplies, how they strengthen communication among staff, among departments, developing new community health initiatives. I just received a project from someone in DRC Congo, um, have developing a sensibilization um, program on diabetes, and they shared videos of the community gathering, speaking their local language, doing all that program. So that was very exciting, and that happened about an hour ago. So when we think about impact, we're really looking at that transition from learning to application, from understanding a concept to using it, adapting it, and turning it into something special. And for example, in Haiti, we've had more than 1,000 enrollments in our courses. And we've seen some of those examples of project implementation in Haiti. And rather than, keep showing you this infographic, I'm going to go and show you and talk about 3 projects that really stand out for us from the last cohort. Um, Lori Moyes, who is the clinic director for Real Hope for Haiti, she participated in our leadership learning path, and she identified a challenge that had become increasingly important for the organization. which was that many major decisions and planning responsibilities were concentrated among a small number of people, and the Haitian staff, who were closest to the day-to-day work, had very limited opportunities to contribute to strategic planning. As Lori explained to us in an email, because she couldn't be here with us today, this was happening. This was happening at a time when insecurity in Haiti caused experienced staff members to leave the country. So there was a great gap between the Haitian staff who could take more ownership of the organization's future. So, using what she learned in the leadership course, Lori developed a project called Building Strategic Voices. The project introduced Haitian staff to SWOT analysis and strategic planning and created a structured way for employees to identify challenges, opportunities, and priorities for the organization. Training materials and planning tools were developed in Haitian Creole, committees were formed, and staff began contributing ideas that could inform Real Hopes for Haiti's 2027 strategic plan. The project is already producing concrete results. 5 committees were formed with 18 members. Staff identified 5 strategic focus areas. 1 committee completed a full SWOT analysis and developed 3 objectives. And quarterly planning tools are now being used to organize and monitor priorities. In her words, Lori says, staff who once felt unsure of their voice are now participating in committees, contributing ideas, helping plan for the future of the organization, and leading others with great confidence. And that is exactly the L4H impact that we want to cause. It's not only about knowing how to manage a clinic, it's also about, teaching forward. As Lori summarizes, leadership is developing voices, not just making decisions. People support what they help create. And in that sense, our second example is one of the staff members from Real Hope for Haiti. Her name is Gavenia Ladang, and she began with the healthcare management learning path and then continued to the advanced project management path. And what she appreciated the most was that the courses were not only theoretical. She enjoyed the different components to the work, and she saw how the content could be applied to her own work. She, with a colleague, they worked together and identified a gap in how the clinic tracked medical supplies. So they developed a system for tracking medical materials. And they not only developed the plan, but they put it into action and realized what was missing, what different departments they needed to get in contact with and compromise from. And from her own testimony, she says, for me, this was deeply encouraging because I was able to take something I learned in the training and use it to help solve an existing problem at my workplace. And they established a goal, as you can see in the second to last box, that says that their goal is to have 90 functional beds within 6 months. And the good thing is that they keep working with us, so we get to follow up as well with those projects in the following months. She says, for me, it was just not about getting a certificate. The training gave me knowledge and practical tools that I can use in my job, and I've already seen the results through the projects I am implementing. And then the final case study, so that I don't go on and on. This is from another, this is not a Real Hope for Haiti project. This is a project from the Delta Centre Hospitalier in Port-au-Prince. There, they also took the healthcare management learning path, and they basically realized that the essential medical supplies were frequently out of stock. So they as well decided to develop a plan of understanding how the supplies were being managed, conducting inventory, understanding the causes for shortages, and developing a follow-up tool with monitoring and evaluation. And they said that they reported a 20% reduction in stockouts because of the project implementation. So you can see how these projects are already causing different results. And what's next? Looking ahead, well, Learning for Humanity, we're always continuing to expand ways in which to respond to the needs we're seeing across our partner organizations and communities. I'm sure Barbara will love this. This October and November, we will offer a webinar series focused on maternal and child health communication. And if you
Nice.
And if you go to our website at Medicines for Humanity, you can already enroll for it. You will see that exact page because that's a screen grab. They are sessions where we are trying to create additional opportunities for participants to strengthen how they communicate within the MCH realm, but also these are webinars that are in addition to what learners learn through their learning path. So this is another component. Not only are students able to take their learning paths, which begin in October, our next cohort, but also even if you don't have time to maybe start a learning path in October because you have a lot of work, you are able to come and join the webinar series because they're open to everyone. And those sessions are in English. We do have live human interpretation in French, and we have AI generated captions in many languages. So if you we invite you to spread the word and share that with all of your network. We're also developing a French language mental health and psychosocial support microlearning series, which will be also available to the public. This will provide short, practical learning opportunities focused on mental health and psychosocial support. The goal is to make this content easier to access and easier to apply, especially for frontline workers who may not feel motivated to go through the whole learning path or who may not have the time or connectivity requirements to do so. And in addition, in our French part, we're translating our WASH learning path into French. This will expand access to training on water, sanitation, and hygiene, and help strengthen WASH practices within health facilities and communities. So our final question is, could Learning for Humanity support your organization? We're open to speaking with you, to maybe sharing a little less fast information with you. But know that our model combines online learning with practical application, facilitation support, and project design around real organizational and community needs. I think the best part of our program is that mentorship in developing the projects, because that's where we really join forces with the participants to understand their local context and help them develop something that could be meaningful. And with that, we're open to the questions, and thank you very much.
Thank you guys so much for sharing. I have some comments and maybe questions. I did see one question come in about, is the maternal child health going to be offered in French? And my question, Adam, would be and or Creole.
Yeah. So the learning path for maternal and child health communication is already up and running, and people can apply and start that learning path in October. Actually, it's like 28th of September that we're starting that cohort, and that is available in English and French. The webinar series, our speaker is an English speaker, so she will be speaking in English, but we will have a live interpretation from someone, from a real life person who will be there translating in French. My suggestion would be, for example, within the Haitian population, they could join and listen to the French translation, but also put the AI in Haitian Creole. The AI captions, sorry, in Haitian Creole.
Okay, great. And another question, Rachel, you asked a question about like costs
Yeah,
for organizations to do these things.
yeah. So if we've now raised we've changed the payment model for in order to also achieve sustainability. So if there's a organization that is going to um enroll a couple of employees, then we have a whole payment scale, and I'm looking for that scale on our website. So if you could please excuse me for a second. But yes, so in-country partners, they get to take our courses for free, but then we ask organizations if they're going to enroll a lot of their students, and organizations that have the budget, that they do so and contribute with their donations so that we can keep I am looking for that page desperately so that we can keep
Rachel, just put
hearing.
your website in the chat, just in
Yeah,
general, because people were asking about that.
I think
yeah,
it's $100, Esther.
yeah, I just found it and I just wrote, yeah. So it's $100 per learner for high income countries whose organizations are based on those high income countries.
And then in low income countries, you said it's no cost. Is that correct? Or am I-
Middle and low income countries is $50 per learning path.
Okay.
And that covers all the courses within that learning path?
Yes,
Oh, wow. Okay.
yes.
Rachel, did you have any other questions? I know Rachel, running learning platforms is, she didn't know she had a passion for it, but she does.
All these things I never knew. I don't have a question, but I will just make a comment. Because as Barbara mentioned, we did have our staff go through the program in French. And one thing that I think was really good that we did was at that time, we had 3 staff members, and all 3 of them went through it together instead of just having one of them do it and then having them be the one responsible. Because really, they all have different responsibilities, but I wanted them to all be learning the same thing so that when they're like, okay, now we have to create a monthly budget kind of thing, they all had that same knowledge. At the time, my goal was that I would also take it with them. I was going to do it in English. They were going to do it in French. Unfortunately, time was not on my side and I was unable to complete that. But I
But you already know how to do a budget, so it was okay.
well, I wanted it to know like what they were being taught so I could match it.
Yeah, I know, I know, I know.
But that's in the grand scheme of things, I think if anyone on your team has the capacity to have your team in Haiti do it, and then have somebody, if you have someone stateside or Canada or wherever, to do it at the same time as them so that you know what they're learning and that all of them together know what they're learning. And I'll just say our team, we definitely want to re-engage and have them continue on the learning path because they not only were they excited and did they learn, but they felt so valued and they were so excited to share with us the things that they had learned. It was a really great experience for our team. And I do hope to take the course and complete it and know what they learned and have them continue.
It's kind of obvious what they learned, though, Rachel, just because of the way reports changed. I mean, I remember when the first report came over, I thought it was fake. Like, I'm not gonna lie. Like, as opposed to what we were used to receiving, again, which we dealt with it, but I was like, whoa, this is a new level here. So,
Yeah.
yeah, I was very much impressed, and I like something you guys shared about, and I think this is something that's really important for us too. Is in all the trainings and stuff that we do is like there's telling people things or there's speaking knowledge at people versus taking the intentionality of making sure that it's really received. And then even taking it a further step that it's not just received, but then they're able to apply it in the real world. And I think all those things are maybe some of the intangibles that you mentioned, Esther, of training, but they're so important of making sure that the content you're delivering is actually being received and then actually being applied. So I appreciate you guys' thoughts on that. And I know that's something that's really important to us as well.
I want to
Yeah.
I want to add for collaboration. Sorry, Esther. We work in public health, but we are not experts on every single thing out there. So there are always opportunities if you're interested in connecting with our team to speak at one of the live events or talk about something specialized. Like I think I saw a physical therapist in here, something else specialized. If you're interested in doing something like that, the micro learning sessions that Esther mentioned, we've done those in the Dominican Republic as well. And they come off very acceptable to people, especially community health workers, because they're so quick and they can learn something directly and they're free. All the sessions at the end about the webinar series, those are free. So if you're interested in collaborating on something like that as well, we would be happy to discuss that. And all of these courses were created based on feedback from people that we work with in developing countries. So we didn't just decide we're going to do leadership. or administration. It was something that we surveyed and with participants and said, what do you need? What support do you need? So if there's another area, like a lot of people in Haiti working in healthcare could benefit from this that's not out there, we'd be happy to collaborate on that as well, either in a learning path or a webinar series to really be able to support people who are working in hard to reach facilities.